In recent days, in many European and non-European countries, there have been a few cases of monkeypox. According to the World Health Organization, there are already 131 confirmed cases and 106 suspected cases in 19 countries, from Australia to Italy, France, Belgium, Germany, as well as from Spain, Holland and Portugal to Sweden, United Kingdom, United States and Canada. The alert level is increasing very rapidly because cases have occurred in countries where monkeypox is not an endemic disease, that is when an infectious agent is constantly present in a population or in a certain geographical area. They are mostly seen in young males who have had sexual intercourse with other males, but it is not a homosexual disease. However, this suggests that transmission could occur during intimate relationships. To date, only mild cases have occurred, and according to experts, the probability of a wide spread in the European population is considered low. Yes, a bit like they said at the beginning of COVID. On May 7, 2022, the first case of monkeypox was confirmed in the UK, specifically in a man from a trip to Nigeria. But what is this monkeypox? What are the symptoms? And how is it transmitted? Let's do some clarity. Monkeypox is a rare viral infectious disease, particularly widespread in tropical countries of Central and West Africa. The name dates back to 1958, when the disease was first observed in laboratory monkeys, most notably the Java macaque. The main carrier of monkeypox disease is still unknown, although the main suspects are rodents, especially squirrels, rats, and mice, and it can also be transmitted from infected animals to primates, to which humans also belong. How does the transmission take place? The causative agent is monkeypox virus, a close relative of the variola virus, the responsible agent that caused human smallpox. It has now disappeared in nature, having caused 300 to 500 million deaths in the 20th century. In 1980, the World Health Assembly declared that smallpox had been eradicated from the earth, thanks to a major vaccination campaign on a global scale. Monkeypox, however, is less lethal and less transmissible than human smallpox. Monkeypox is transmitted from animals to humans through direct contact with saliva, blood, body fluids, or skin or mucous membrane lesions of infected animals. The infection can also occur following a bite or the consumption of meat from infected animals, not properly cooked. Human-to-human infection is more difficult, but possible. It can occur through close contact of the mucous membrane or skin not intact with the infectious material of the lesions, or through the breathing of droplets of saliva emitted by an infected person following prolonged face-to-face contact. It can also be transmitted through contact with objects contaminated by its body fluids, such as towels, sheets, and clothing. What are the symptoms? Symptoms of monkeypox are similar to those of smallpox, and typically the incubation period varies from 6 to 14 days after exposure to the infectious agent, but in some cases it has been up to 21 days. In humans, it occurs with fever, muscle aches, intense headache, fatigue, back pain, and lymphadenopathy, which is swollen lymph nodes. The latter symptom is a defining feature of monkeypox from other diseases that may initially appear similar, such as chickenpox, measles, and smallpox. A rash usually develops 1-3 days after the initial fever, often starting on the face, palms, and soles of the feet, and then spreading to other parts of the body. The rash evolves in this sequence. It passes from macules, flat lesions, to papules, slightly raised skin lesions, characterized by sharp edges. Then they become vesicles, fluid-filled lesions, then evolve into pustules, circumscribed lesions of the skin that contain pus. Eventually they become scabs, which dry out and then fall off. In severe cases, the lesions can fuse and large sections of skin break off. People born before 1981 are nearly all vaccinated against human smallpox, and therefore possess antibodies against a potential monkeypox. Several observational studies have shown that in 85% of cases it is effective in the prevention of monkeypox. On the other hand, people who are not vaccinated against smallpox may have a higher risk of contracting monkeypox due to the absence of antibodies. What are the consequences? The disease resolves spontaneously in a period ranging from 2 to 4 weeks, with adequate rest and without specific therapies. If necessary, antivirals are given. People who may be most at risk are immunosuppressed people, very old people, and pregnant women. Complications of monkeypox can include secondary infections, such as bronchopneumonia, sepsis, encephalitis, and corneal infection, resulting in loss of vision. In West Africa, the mortality rate has been estimated at around 1%, while in the Congo Basin it can reach up to 10%. In recent times, the death rate has been around 3–6%. Experts remember that if you were infected, you should remain isolated until the scabs fall and avoid close contact with immunosuppressed people and pets. Close contacts of monkeypox cases should self-monitor for symptom development for 21 days after the last exposure. It is still unclear whether the virus responsible for monkeypox has mutated. More precise answers will come in the next few days after scientists have sequenced the viruses of the current outbreaks.